it's really important to make the best use of the knowledge of different people. We all learn in a different way. We are all different, and therefore we share those experiences and that knowledge in a different way. So it's really important to understand what we are doing, and just have an open mindset and an open heart to learn and to see things from a different perspective.
Welcome to the conversation. In today's episode of Trailblazers, Johnny is speaking to Alex Hernandez, digital health consultant and expert in health tech policy. We hope you enjoy this episode. Be sure to subscribe and follow us on social.
Alex, it's a pleasure to have you here today. For those who may not know, give us a little bit of background on yourself and introduce yourself if you don't mind.
Thank you, Johnny. It's lovely to be here with you, and thank you for the invite. My name is Alex Hernandez. I am a healthcare policy consultant. I have around 15 years of experience working in the policy background. I am a health economist by profession, and for the last 8 years or so, I've been working in the digital health space. I have a passion for transformation, innovation in healthcare, and that is what drives me every day. I love diversity and inclusion. I'm sure that we will touch on those things later in the conversation. So, yeah, amazing to be here. Thank you.
Incredible. So you mentioned the digital transformation. How important is it within a digital transformation project to have leaders that communicate effectively and are able to draw all the threads of their team together?
Yeah, well, I think that's an amazing question, because leadership and inspiring others start from addressing clear and concise messages. Communication is absolutely critical to build trust, to build effective teams, to feel better working with people, and it's really how we inspire each other. I always like to feel that when you are leading, when you are working in an organization independently, if it's healthcare or not, you want to communicate appropriately. You want to inspire others about the mission, about the values, what drives you, being there just so people can align to what you're doing. People like working together and making their very best if they know what they are doing, where they are heading, and what is the set of values that join all of them. People like to be motivated, and communication allows for people to feel motivated in what they are doing and how they're doing it. Decision making is another point that I think is really, really important for people to have clear powership, to empowerment, to feel that they are making a change, that they are making an impact in what they are doing. Innovation, that's what it's the clear thing around how we communicate a change, a transformation. How are we taking people from one place to another, and what's the clear route? People is going to be committed into what they are doing if they know what they are doing and how. Ultimately, we're talking about healthcare organizations. Communication is absolutely critical for people to make better plans into providing a better healthcare for everyone. And absolutely, staff morale will be impacted as well if communication is clear and concise.
Yeah, we had a conversation previously with a chap called Bob Pierce, who was a colonel in the army for 36. Well, he wasn't a colonel for 36 years, but he spent 36 years in the army. And one of the things that he spoke about when he discussed leadership with us was the officer's intent.
Yeah.
And this is often reflected in a letter to the team or to his battalion or the group of troops that he's going to be looking after. Let's put it that way. How important do you think it is when in NHS or kind of healthcare systems, that officer's intent, so to speak, that intent of the person going into a leadership position to say, this is the goal that we're looking to achieve or the change that we seek to achieve? How important is that for getting people on board and being very clear in that intent when they start out?
It's really important for people to know what they are doing, and absolutely to secure their buying into a decision. Let's say if I get into a conversation with someone without really having a plan to connect, it's likely that the job and the things that we will be doing, they are disconnected, and we have seen that in so many projects and organizations, and I'm sure that everyone have been through projects like that in where people is just disconnected. When people is disconnected, you're getting nowhere, and it's absolutely like a waste of time and energy, and you create like an environment when you cannot have really good conversations. I feel, thank you for sharing that experience about the letter, but it's about getting to know each other. For some people it's going to be better, just to have a quick conversation over the phone. Some people will have it better on a clear, concise message in an email. Some people may have it so much better connecting on a virtual way, and some others on a face-to-face way. We all have heard that there is evidence proving that those conversations before a meeting, after a meeting, or even when trying to grab a cup of coffee, they develop so much trust that allow people to work in a better and more effective way. So absolutely, it's about knowing each other and being a little bit more understanding and mindful about the background, about the interest, and all of that that drives you to make our very best in the activities we do. So yeah, absolutely, that is key to bring each other together. As human beings, we all like connection, and we need to be thoughtful about others and how others will be thoughtful about us as well. Johnny, just thinking about that, you have been working for a while in agile methodologies, and this just makes me feel how communication, it's so important when we talk in an agile way. Talk us a little bit more about your experience in this way. I am curious to know about your journey, really.
Absolutely. So, agile methodology is really, for those that may not know, it's a way of working in which you encourage this process of incremental improvement. We often have a dangerous process in the past of doing what's called Waterfall, which is essentially setting an ambitious goal for a project, and unless it reaches the milestone of perfect delivery at the end of it, that is the goal that we're seeking. And unfortunately, in those circumstances, what often happens is, if things don't go according to plan, or gremlins come out of the system, or something crops up, people can feel along that journey a little bit, disheartened. They can feel like it's taking far longer than it should have done. So what we like to do within an agile methodology is we do still set those extensive stretch goals. We set those kind of milestones that we want to achieve. But the thing that's really crucial is that we break them down into smaller sprint cycles. And doing that basically means that we have that clarity across the team where we assemble all of the key stakeholders. We establish what the goal for that sprint is going to be. And we break that down into kind of individual tasks. And we establish who is going to be responsible for all of those pieces. And then what we do is we have a sprint planning session at the start of the week where we assign those tasks to a given individual. And then we assign those a value across the week in terms of, we size the tickets that are going to be executed on that week. We assign the responsibilities, and we make sure that whomever is responsible for those is able to deliver them in the most effective way possible. So really, Agile is just a way of breaking things down into a smaller, shorter, more manageable way of doing things that provides a little bit more return on investment that's actually observable for people as they go through the process of a project and through the process of delivering that project, really.
I am sure that you have seen good and I don't want to say bad examples, but different challenges along the way. So that's really insightful. Thank you.
Yeah, absolutely. It's one of those things where we've, as you say, it's not necessarily about highlighting bad experiences, but there are some challenges that come with adopting a new way of working, especially when legacy systems and processes have been in place for such a long time. So oftentimes, as much as you try to implement an agile methodology, it essentially can sometimes be waterfall in disguise, where unfortunately certain teams are so used to that way of working that they really set goals that are just they're not adopting the way of working properly. And to the point about communication, that's where it's really clear about, not just top down, but bottom up communication about how much we are aiming to achieve, how much is realistic to achieve in a given time frame, such as a sprint. A sprint is there to be a specific focused activity that achieves a certain list of criteria and objectives in a short, sharp time frame that demonstrates clear return on investment. That's something that absolutely everyone in a team can get on board with, and the leadership side of things can see that. And then also it means that the team that are executing on that work feel empowered, to the point that you made earlier about, okay, well, my contribution to this is taking us in a positive direction. Because when you have these big initiatives and you have these big strategic imperatives, sometimes they're so far reaching and so expansive, it can be really difficult to understand when you're actually making a difference and where you're moving. Because in any big organization, such as something like a healthcare organization, many times they're described or akin to something like an oil tanker, where it's that process of turning the ship can take, one turn of the wheel can take a long time to see the effect by the time that the rudder moves into the right direction to move those degrees. And so we need to be mindful of that, which is why it's really important that breaking things down into those shorter, sharper sprints becomes a standardized process and way of working that means that people get to see, okay, well, we've achieved this, and this goal this time on our sprint. That means that next time we've got these tasks and activities, and we know that that's incrementally reaching the goal that we've set out, that's the strategic North Star, or the thing that we aim for. Now, the other thing that's really interesting about this methodology and way of working is that sometimes that North Star may in and of itself move, because you have the goal that you want to reach. But as you go through those processes, Agile means that you have the flexibility and adaptability to accept change and not see change as a bad thing. Change doesn't necessarily mean failure. Change just means that you're responding to what's in front of you in a pragmatic and proactive way. And that's something that's really key to ensuring the success of any digital transformation project, any project whatsoever, because as the saying goes, you hope for the best but plan for the worst. So it's really important to be pragmatic in those situations. Speaking of, evaluating good and bad experiences, I mean, obviously, as we say, it's not necessarily bad. They're just different challenges and kind of frustrations that we may come up. What are some of the examples where you've seen, Alex, challenges within healthcare settings to get something over the line in terms of a project or a breakdown in communication that's really led to something not working as ideally as it could, but equally a situation where it's been completely the opposite, where actually everyone's been really communicative, the lines of communication are really open, and everyone's really on board with the mission?
Yeah, that's a very, very good question, Johnny. I am in digital health, so digital health is just a fascinating topic in terms of everything has to be agile, right? So we're working with innovation, we're working with technologies, but those technologies are used by people, and those technologies are used to improve healthcare for patients as well. So, and they clearly disrupt all the way a different pathway is looked at. So yeah, absolutely, communication, leadership, and all that, it just comes into play. um, we have talked about trust, how trust is so important in terms of people just trying, to adapt. You're trying something new, you're trying something that uh, perhaps not everyone has bought into, so you just need to connect. It's so important to connect and to make people feel that they are all on board, and they are just empowered to have a different process and a different participation into the decision making process. So we have all come to realize how important it is to secure this from an earliest stage in the journey. We have a lot of very good examples around electronic patient records having been designed and implemented in big trusts. All of that, of course, is not a plain field. It involves constant engagement, constant working in how people trust each other, and how people just rely on the importance of this failure that, I don't feel really comfortable or using that word. You and I have had earlier discussions around what is failure. Do we need to still think about failure in the same way, Well, not really. This is a journey, isn't it? It's a journey of embracing kind of a lessons learned approach into let's keep learning about how to do this, how not to do this. And it's absolutely key to communicate in an open and honest way in order to move things forward. You are trying to create a transformation and a change, and you're challenging at the same time traditional ways of working and mindsets. So it's around how we move, with different people, we move our teams, and how we move our new projects into different ways. And that's not going to come, on a first and quick way. It's going to involve a lot of engaging, a lot of continuous work, in which you realize that there are mitigations that you have there are risks that you have to mitigate along the way in a flexible way. And just taking a couple of your comments around agile methodologies, that's innovation, that's transformation, and that's a new way of working. So you just have to work with a different mindset into we need to work together, collaborate, and just have sounding boards regularly and constantly. And that's just going to go into an environment where trust is there. I know that it sounds easier than it's always sound easier than it's been done, because that means that we are challenging constantly people and mindsets that are different to us. But that's where new ideas and innovation thrive, really. I apart from the implementation of the electronic patient record system, there is one example that I want to give here, that it's an amazing example of how people is just challenging the status quo on the system. It's an organization called the Shuri Network. A couple of people in the NHS, fantastic leaders, all joined up by the initial idea of Dr. Shira Chok, and they are just constantly challenging the ways in which we take diversity and inclusion efforts within NHS organizations, how they are empowering people from minority groups, people from color, working in the NHS from a clinical perspective, into how they can keep developing themselves, how they can create a network in which people support each other and they feel just more empowered. That's a fantastic way of challenging the mindset, the system, and the status quo of people. And they have been, doing fantastic milestones that it's worth raising the voice. It's worth celebrating all those ways of challenging, changing, and transforming people. And how they can really give different benefits in the system, and most importantly, the changes that they are doing to provide a better healthcare.
Yeah, I think it's really, you've touched on so many things that I want to unpack there. I think the mindset shift around embracing failure and seeing it as not failure, but instead seeing it as an opportunity to learn. Actually, failures within any change or process where you're trying to get to another state, taking something from one place to another, you're going to use strategies that are presumably things that haven't been done before. You're in uncharted territory, and
Mhm.
that's where
Yeah.
often we need to be. We need to be pushing the boundaries. We need to be experimenting. We need to be trialing new things, and that will come with risk. That will come with the risk that maybe the things that we assumed and our hypotheses are not correct, and maybe we need to pivot. Maybe we need to adapt. Maybe we need to learn. And that mindset shift of failure being almost like your best teacher and being your best friend in some cases, where it just goes to show you that actually is a bit of a watchword. If we're not pushing hard enough, that we're failing in some regard, or we're not achieving all of the things that we set out for, then perhaps we're not pushing aggressively enough. I think that's one of the key things that often with agile and other ways of working, that it's important to remember that the goals that we set, and this is something that I said at the beginning when I spoke about stretch goals, those goals are supposed to be lofty stretch goals. They're supposed to be difficult to reach. They're not supposed to be kind of, oh, we're going to do this small thing and that's going to be good enough. It's not about doing that. It's about embracing failure, embracing that growth mindset, and being able to accept that sometimes we're not going to get the outcomes that we want, but that every turn, from every learning, from every conceivable failure that we do have, we will have many, many positives. We may have an occasional failure, but it gets us that much closer to where we want to be. And building teams around that and bringing in more diverse voices, bringing in cognitive diversity as well, which is so important to building the success of teams. That means that we don't build solutions that fold in our own biases is so important. And I think touching on something there that you were obviously you just mentioned, that is so important. What do you think some of the more important aspects of bringing in that that cognitive diversity? What is it? What impact have you seen that have on projects as well, where those extra voices or those other voices in the projects have really made a difference to the outcome?
I think very important is just to have an understanding about how different we all are. So the people that it's creating the service, it's very different, and we should be a reflection of the people we want to serve. That is absolutely key. We have fantastic, fantastic diverse staff within our organizations, and not just in the NHS, but in the organizations that work with the NHS. I'm talking about the academic sector. I'm talking about the health. Um, uh, Policy tanks. I'm talking about the supplier base itself. Uh, Everything. We are a diverse group of people trying to make things different. We are coming from different languages and different ways of understanding the same problem, but we are a diverse group and we are able to allocate resources in a different way. We are able to create different projects, different technologies, and different services that serve the population that it's already too diverse. So that's a fantastic thing, that we have to make the most of it. Of course, it's not easy. We are working from different angles and we have different agendas, we have different interests and pain points, but precisely bringing people together in a collaborative space where people can trust each other, then we are able to comprehend better this complex reality. And that's something that we need to make the most of. It's not easy. Why? Because the problems can be understood in a different way, but there's need to have this facilitation and collaboration mindset into we are gonna perhaps have some interim failures. Again, I don't like to use that word, but there is need to be putting this reinstating this communication, dialogue, and collaboration really. I feel there is a lot to be done in understanding where everyone is coming from and try to move things forward. Again, you have mentioned this in terms of agile methodologies, how we need to be uh, putting that message in different ways and move on.
Incredible. So, Alex, we spoke about the importance of that cognitive diversity within a team, and we also spoke about the importance of collaboration. How much do you think it's a vital part of any team's success being able to share the knowledge that they've developed over the course of a project? So within NHS trusts or within trusts and hospitals around the UK, obviously there's many different pilot studies, there's many different innovations happening at any given moment in time. The challenge can often be that those teams and those innovations happen in a silo. So how do we get better at sharing some of the outcomes and sharing some of the learnings that we've established from those pilots, from those studies, from those teams that are really operating in an innovative fashion?
That's a really good point, Johnny. We all know that learning from lessons, it's always much better. Learning from those failures that we have been talking about, or those things that are not the best way of doing our ideas and activities. Unfortunately, those are perhaps not well documented, and it's really important that at least in digital health and in healthcare organizations in all the sectors really, we learn from them. It's really important to make use in the best possible way of all that learning that has been achieved through all the people working in these projects. It's very important to get documented, and also to be those ideas to be disseminated in an appropriate way. Talking about neurodivergent people, we have a lot of richness in the teams, and all of the diversity that comes of the people working in different organizations in the NHS, and all of that should be a reflection of all the population that we are trying to serve, that it's diverse as well. So it's really important to document all those journeys, all those lessons learned, and to disseminate them in the right way. I believe there is a massive power in the networks, in the way of those networks and conversations of people within the field getting together. Events, you and I had a fantastic opportunity of meeting each other last month in Rewired. Coming to those events, it just opens up a million possibilities of talking to people that work within the health sector in different organizations, and just being exposed to this different mindset and these different activities around the same topic. People coming together and making real connections is going to allow, new ideas and new challenges in the way we think. It's really important to make the best use of the knowledge of different people. We all learn in a different way. We are all different, and therefore we share those experiences and that knowledge in a different way. So it's amazing to see that once you get real connection with people, not only patients, but also the staff and the team members, not only clinical people, but also admin people, also people working in the supplier base. We are all so different and so rich knowledge around there, that getting to understand how everyone is just allows us for more diversity in how we learn from each other. So it's really important to understand what we are doing, and just have an open mindset and an open heart to learn and to see things from a different perspective. There is a lot of work being done by different trusts, different ICBs, and different ICSs as well, into sharing their successes. In innovation, it's very important to make a big thing of successful projects, also challenging projects, and just celebrate those wins. Coming back again to what we were just saying about the failures, let's celebrate what we can learn of all those experiences and make the most of it. Agile methodologies, it's around also acknowledging, the big wins, the small wins, and promote those changes that we make along the way. That is what motivates all of us, isn't it? It's what makes us feel there's a challenge there, and there's a continuous learning process. That's what innovation is about: a continuous learning and continuous adapting to different activities and people. So that's what made me feel really motivated around talking with you today, because that is exactly what you have been doing. As well, you have been finding different challenges in working with healthcare brands, and you have also found many opportunities of how agencies can support healthcare organizations. So please share with me and share with the audience what have been those opportunities, and what has been your journey as well, because that's an innovation itself, trying to bring your new mindset and how you see things, and how you can also support the transformation in healthcare.
Yeah, so I mean, thank you for the question. I think it's from my perspective, the reason that I'm able to see things differently is because of the background, as you say, that I've had that's slightly different. I came from a user experience background, working within startups, technology companies, and really my lens on return on investment has always been one in which it's a very short time horizon. So Agile is just a core part of ways of working within any tech team, with any startup. Everyone will be familiar with it. And it's a way in which you clearly demonstrate that we're working towards a longer term vision and goal of an organization, and achieving that in small incremental steps. As you say, accepting the failures that you have along the way, but celebrating those failures as an opportunity to learn, and then celebrating the wins that you have along the way, and creating a plan that is, when you have your retros, you have your washes up at the end of the sprint cycle, you've learned from the failures that you've had, you've learned from the successes, and then you determine how you can best move things forward. From the perspective of a UX designer coming into healthcare, I think one of the challenges that we really saw was a fragmented system, and one in which there are silos, and part of our role is breaking down those silos and being willing to engage in conversations in a manner in which we can be the connectors, build those bridges and bring people together. Because fundamentally, it's about considering all stakeholders within the ecosystem of products and services that are existing in the healthcare system. And that means engaging with all stakeholders. It means engaging with stakeholders that are both on the clinical side and the patient side, and understanding what those experiences look like as best in class for both of them. So where we do a lot of work is in the research side of things, understanding what good looks like and how we can move the needle for, clinicians, for patients, for systems, and how they integrate together to give, the most effective outcome. And this doesn't by any stretch of the imagination mean that it's an all singing, all dancing, super high tech solution like an AI, a machine learning or something like that. It could just simply be taking it right down to basics within a GP practice, allowing someone the opportunity to fill in a form or set their appointment time on their device, on a digital platform, rather than having to call up a GP practice, and many other things that we're looking at as essentially what is that MVP? What is that minimum viable product or solution that we can get into giving a maximum return on investment? And then we go from there. We use that as the baseline that's going to prove effective, that's going to prove, it's going to have what's the kind of like the minimum effective dose, sort of, to use the terminology that we would be able to provide, that gives us something to add that value. So that's the lens that we've taken on things, and that's the lens that I try to apply. And then looking at things from a really top level view and viewing it as an ecosystem. How do all of these moving parts integrate together? How can we facilitate them working together that much more harmoniously, so that rather than, the orchestra of the NHS playing different parts of the symphony at different times, how can we start to bring them together so that all creates this beautiful rounded piece of music that we want it to be? And that's part of the role that we're playing in there. And those are some of the challenges that we've tried to address in some way, shape or form.
Well, that's really insightful, because that's what makes the challenge nice, isn't it? Just bringing a new perspective into the music, into the orchestra playing. That's one of the things that I consider fascinating. It's not about teaching each other; it's about sharing and learning together.
Absolutely.
And I'm hoping that you have seen that from working with different people in a GP practice, for example, and just working from a more humble way, if you like. I remember when you and I had this initial conversation about how we could do this, and I said I like and I prefer more thinking around a fireside chat in which
Yeah.
both of us, coming to the same learning and the same journey, in a way of sharing what we have been through, because everyone has something, new to put into the table when we are trying to do things and understanding things in a different way. That always takes a little bit of courage. It's always nicer to make a starting point as a I'm gonna teach you what I know. That's not really, the case, because no one has all the truth, especially when we're dealing about complex realities. And that brings us together into the same learning journey in a more plain way, if you
Oh,
if you like.
I couldn't agree with you more. And I really love the fact that, the way that I try to approach things with all of these conversations is, in martial arts, it would be called a white belt mentality. This kind of you're the beginner.
Mm.
You don't know anything, and you are an open book ready to be inscribed upon. And maybe along the way that you'll take some of those ideas, they'll percolate and mix with your own, and then you'll be able to reframe them, push them back in an interesting way that creates a dialogue between two people that are open,
Yeah,
receptive, and willing to learn from one another. I
yeah,
think that's a really beautiful way of engaging with the conversations, and I hope that with the work that we've tried to do, that mentality, that mindset, that way of looking at the world has come through. Because to the point that you were making, we certainly don't have the answers. We are very much working with incredible people, having insane and wonderful conversations with the most incredible, as I say, people, and they're so expert in their fields, and it's a real privilege to be able to engage in those dialogues. But equally, just because you're an expert in, neurology, or you're an expert in a cancer pathway, or a particular part of a cancer pathway, it doesn't necessarily mean that your clinical expertise translates in a way that you might best communicate with a patient group about, what their actions might be, those plain language summaries, those things
yeah,
that people need to create that psychological safety and build that trust. When you're dealing with the vast numbers of people that many of these clinicians are on a day-to-day basis, time and the brevity of time that you get with them unfortunately can in some cases lead to a certain amount of detachment. So how do we introduce that kind of more human element again back into the communications? And that's where we come in. That's the lens on things that we provide, both for the people that we work with internally in large organizations, the
yeah.
customers and people that we have, and how we basically make things just that little bit better and a little bit more easily understood. Because within the world of healthcare, there's so many acronyms and there's so much to learn and
Yeah.
information that we get to spend you and I get to spend our days doing this. The patient doesn't. They don't
Yeah,
know what certain
yeah.
things mean. So that's where we try to operate, and I'm eternally grateful for the opportunity to do that. And yeah, it's easy to be humble when you're surrounded by amazing people like yourself and
Oh,
and
thank you,
the
John.
other wonderful people that we get to work with.
Yeah, I think it's a matter of making a start into. You used a word that I like, facilitation. When you facilitate these discussions around, we are all here to deal with a complex matter, and let's try to make the best for that using our knowledge and our own experience. And just coming back again to this connection of the mission, the vision, and what we are really intending to do, which is have an impact in patients' lives and their carers, their family, and our teams. So this is a complex matter. No one absolutely have the total truth. No one has the total and final solution, and it's a matter of let's document the journey, enjoy it, learn through it, and make it work. It's
Yeah,
getting through a transformation, and communication is absolutely key. Connection is absolutely key, and it will always be. So let's come back to the basics. Some people say communication for dummies, if you like, but it's the basics, isn't it? How you communicate with people
absolutely.
and connect through values and the mission and through the basic principles of what you're trying to achieve.
100%. And it brings me back very nicely to the core philosophy of our company, which is simplify, amplify, and ignite. And you used two of those words there right off the bat. It's the simplification of complicated problems or complex systems. We need to simplify those. So if you can make that understandable to the widest common group and the lowest common denominator, you have an ability to amplify the reach and scale of that message and those messages, which means that you can ignite someone's ability to do something with that information. They
Mm,
can take an action, a positive action towards a better healthcare outcome. So for us, that ability to simplify, amplify, and ignite is at the core of everything that we do. And it's something that we spent a lot of time, spent a lot of time thinking about, and it's something that served us very, very well.
Oh, I'm very pleased that you have that connection with the company, and coming back to basics, you are connecting and you are smiling. One of my previous experiences I used to have with previous NHS organizations that were I was working with. When you have a conversation and someone smiles, you connect it. You have an
Yes,
agreement that it's explicit, and you have an agreement of, okay, we have communicated clearly, and we can move on. You don't have to agree, but you can agree to disagree sometimes and move on and grow together.
absolutely.
And that's what it is about. It takes so much more than the knowledge and the things that you can share on a technical space, but connecting, smiling, looking at each other and trusting to have different conversations. I just feel that that is the key, to move forwards and do things differently and improve in ways in which you don't know how it's going to improve, because you're managing uncertainty, environments and projects. But this is what it is about. All this agile approach and the approach of engaging, collaborating, and transformation. It's around really being committed and clear about where are you going, and how are you going, and how you want to be traveling through that journey with people. But it's absolutely a learning journey. It's not about teaching each other. I recall my different projects working with organizations within the NHS, and also with private suppliers who design the technology. We need to teach the team in the NHS organization. We need to teach the supplier. And just coming back, let's not teach each other, let's learn together. And
Yes.
I feel that's the way to go.
Oh, that's such a beautiful way of seeing the world, Alex, and I really, really love that.
Thank you,
Um,
Johnny.
if people want to engage more in this conversation, where can they find you? Where can they go? How can they connect with you?
Thank you. I am always happy to connect with others, so please reach out to me. I have my LinkedIn. I am trying to be as active as I can. I normally work for NHS organizations, and my passion, you already know, it's about engaging and collaborating. I like working in emerging technologies now: artificial intelligence, immersive tech, and also process automation, robotic process automation. So please connect with me on LinkedIn. My email, I am happy to leave all my contact details for you to please share with the audience. And of course, please reach out to me and continue the conversation. I am always happy to keep learning and challenging myself as well. That's a fascinating thing during my digital health career journey. So thank you. Please keep doing the same. And thank you so much for inviting me to this conversation.
Right. It's been a pleasure. Thank you so much, Alex.
Thank you. Thank you, Johnny. Bye bye.